Good morning, everybody. Thank you for joining us for this press briefing on the state's response to the pandemic. As usual, we will start off by reminding people that with the virus still in our community, we need everybody to please continue to practice all the tools we gave you, follow our rules to be able to slow the spread of the virus. That means that we need to keep that 6 foot of distance between you and other people when you're in public. Wear a mask, especially when you can't do that. But if you're going to go to the store, wear a mask. Wash your hands often for 20 seconds at a time. That will actually kill the virus. So that's a great thing. Stay home when you're sick. That's a big deal. I know Nebraskans love to work and they want to get back at it. But if you've got any symptoms, you need to stay home. Please go get tested, but do not go into work if you've got any symptoms. And of course, that should be true even if you test negative for coronavirus. If you've got symptoms, please stay home. You don't want to give the flu to somebody else. We need people to really follow that rule about staying home when you're sick. When you go to the store, go once a week. Go by yourself. Don't make it a big family trip. Please avoid the 3 C's, those crowded places, confined spaces, and close contact. That's how the virus spreads. It spreads from one person to another. So if you're in a crowded place, a confined space, or close contact, that's when you give the virus an opportunity to spread. So please continue to follow all of our good rules with regard to how we slow the spread of the virus. And then, of course, Test Nebraska is an option available for all Nebraskans. Over 530,000 Nebraskans have signed up and done an assessment at Test Nebraska. We've delivered 448,000 tests through Test Nebraska. The turnaround time is 24 to 48 hours, so you can get that turned around in a relatively quick manner. And of course, it's free. We don't sell your data to anybody. Go sign up for Test Nebraska and you look for a schedule. We have increased those testing schedule slots so that you can get tested more regularly if you want. And of course, with the holiday coming up, that's always a great opportunity, so we've planned for that. And of course, all these things we do are about making sure that we slow down the spread of the virus to preserve our hospital capacity. We have 976 people in the hospital as of yesterday with coronavirus. That's more than 4 times what it was on October 1st. So we need to be able to slow this down to preserve that hospital capacity. Right now we've got 30% of our hospital beds are available. We've 30%? Yeah, 25% of our ICU beds are available and 70% of our ventilators. Now, as you know, about a week and a half ago, I published a plan that shows that if we hit 25% of our hospital beds being taken up with coronavirus patients, we are going to go into the red category and there will be additional restrictions. We will limit indoor gatherings to 10 people or less. We will limit outdoor gatherings to 25 people or less. Bars will only be able to provide takeout, delivery, or drive-through. And restaurants will have limited hours, 5 a.m. to 9 p.m. So these are some of the restrictions we're looking at if our hospitals, or the patients in the hospitals with coronavirus goes above that 25% threshold. So again, folks, please do your part about slowing things down. Now, one other thing, this is the holiday week. So we've got Thanksgiving coming up on Thursday. Please reduce the size of your Thanksgiving holiday gatherings. We're doing that in my family. Smaller groups will make it less likely the virus spreads. Bigger groups means more opportunity for the virus to spread. So please avoid that. And then another thing that apparently I'm kind of old, don't remember this anymore, but apparently Wednesday night is a big night to go out to the bars. It's actually the biggest night in Nebraska for DUIs. Please, folks, the best thing to do is actually don't go out to the bars on Wednesday night. Let's try it again. Bars are going to be a place where if you've got crowded bars, you're going to hit all those 3 C's, right? You're going to have the crowded spaces, confined places, and close contact. So a better option, the best option would be to stay home. If you are going to go out, find a patio with an outdoor heater and drink outside. That's going to reduce the risk that the virus spreads. And especially before Thanksgiving, you don't want to pick it up and then go take it to grandma and grandpa. So please do that. And then, of course, also, do not drink and drive. Especially in this age of Lyft and Uber, do not drink and drive. As I mentioned, the Wednesday before Thanksgiving is our #1 DUI night in Nebraska. Don't avoid, do a good job avoiding getting coronavirus and then have an accident because you were drinking and driving. So please do not drink and drive. So we got a lot coming up this week with regard to the holidays. Please continue to remember that we've got the virus out there. Please take steps to change this holiday season because of the pandemic. All right. Today is also our National Public Health Thank You Day. So this is a national day that we recognize all the folks who work in public health. And that's from contact tracers through our doctors and nurses. And everybody in public health has been working around the clock for these past 8-9 months to be able to keep people healthy here in Nebraska. So it's a great opportunity to be able to say thank you to all those officials. I want to remind people that, again, especially when it comes to our contact tracers and our local public health people, they are just doing their jobs when they're reaching out to you to tell you to isolate or quarantine if you've tested positive or been exposed. Please treat them with dignity and respect. Leave a little space for grace. They're trying to keep people healthy. It would be a great opportunity today to say thank you because it is Public Health Thank You Day. We're going to be lighting up the Capitol in blue and encourage everybody to turn on a blue light if they can to show their support for all of our public health folks. So please say thank you to those public health folks, whether it's that contact tracer that maybe gives you a call or that doctor or that nurse. If you happen to see one of them, please tell them thank you. We want to remind them that we appreciate and support them. And to say a few more words with that, I've got Dr. Gary Antone, who is our Chief Medical Officer for the state, to be able to come and say a few words about that as well. So, Gary?
Thank you, Governor. As the Governor mentioned, public health professionals have played a critical role at this period of time and every day in the health of all Nebraskans. They've been working nonstop to protect us, to slow the spread of the virus during this pandemic. And this has gone on now since January of this year. First, I'd like to start by giving a heartfelt thank to our own Department of Health and Human Services public health team, not only for their efforts during the COVID-19 response and all the team members responsible for that, but also for the other employees that have been doing the day-to-day work to ensure that we have clean air and safe water, less disease, provide safe providers and facilities, healthy schools and workplaces, and our communities are safe. We also have on our team programs like the Tobacco-Free Nebraska, Women, Infant, and Children Program, Newborn Screening, Injury Prevention, and our Vaccine for Children's program being run on a daily basis. The team has done a great job in keeping these programs running like normal despite the pandemic. Second, I want to thank all our local public health departments. Simply put, we couldn't do our work without them. They are our most valuable partners, and we've spent several decades now working together. Some people might not know this, but every county in Nebraska is covered by a local public health department. This marks 20 years now that this has been taking place, making available public health at the very local level. I've mentioned before that our healthcare worker staff is becoming fatigued, both physically and mentally. Think the same for our public health department staff and directors. They've been at this now since January, tirelessly, little if no time off, and they deserve our thanks today. They're the cornerstone of our public health efforts. They work with the schools, with the hospitals, with local businesses. They're advocates for you in your community. I'd also like to thank, as the governor mentioned, our healthcare professionals who continue to provide this excellent care that we're receiving due to our pandemic. As Nebraskans, today is our opportunity to show our appreciation and say thank you if you get a call or if you run into a public health professional or healthcare worker. They are our heroes, but we need to do more. We need to support them in our actions. We need to save lives by reducing the transmission of the virus. We need to limit our person-to-person interactions, wear a mask, watch your distance, wash your hands, and avoid the 3 C's: crowded places, close contact, and other confined spaces. There is no doubt we are living in extremely challenging times. Our cases continue to increase. Our hospitalizations continue to increase. It's straining our state and local resources and workforces. Just like the flooding of 2019, we must pull together and help each other. The next few weeks will shape the course of our pandemic history in Nebraska. Your decisions and how and when you gather with friends and family and in the community will determine whether our hospitals and our local health departments will become overwhelmed. Our local health departments are counting on you. Our health care providers are counting on you. And your loved ones are counting on you. Don't let them down. This is the time again to pull together, care for each other, and protect one another as best we can. Again, thank you to everyone in public health, and thank you, Governor, for allowing me to speak today on their behalf.
Great. Thank you very much, Dr. Antone. Appreciate it. All right, so one of the things that we have done is bring in coronavirus survivors to be able to talk about their experience. Most people that get coronavirus may have very mild symptoms, but we know it can severely impact some people. And so we want people to know that, and I think as we've heard from some of our past speakers, that if you get this virus, you can be one of those people that is impacted. You can have those severe symptoms and also lingering effects. Today we've got Tyler Thompson, who is a teacher in the Gering Public Schools, that is going to join us by Zoom to talk about his experience. He had it just a couple of weeks, or just a few weeks ago, with regard to the coronavirus, and still has some of those lingering symptoms. So with that, I'm going to hope we'll have, oh, not Ken Smith yet. We're not going Ken Smith yet. We need Tyler Thompson. There we go.
Governor Ricketts, thank you for the opportunity to speak with you today and to share my story. Within the last couple of weeks, I joined a new fraternity. I joined the thousands of other Nebraskans who have tested positive for COVID-19. My symptoms began right around Halloween. I was at school. I felt like I was catching a head cold like I do every fall. I work with hundreds of teenagers a day, so I just figured I had caught a bug. And it became apparent that I had not just caught a cold when I lost my sense of taste and smell. I immediately quarantined. I scheduled a test. I found out that I was positive and did my part to stay home and make sure that I didn't pass the virus on to anyone else. It's been almost 3 weeks since I was ill. I have been back at work after being cleared by the Panhandle Public Health District. I've been back in the classroom for 2 weeks. And even though I am recovered, I still battle with some fatigue and random headaches and a niggling cough that just pops up at random times if I push myself a little too much or go up a flight of stairs too fast. And so I definitely understand today in a very different way than I did 3 weeks ago that this virus affects everyone differently, and it's something which is very serious, and it requires our vigilance. Scottsbluff County, where I live, we are one of the hardest hit parts of the state right now with virus cases. I just looked this morning. I think we have around 1,800 active cases. And so it is so important that we continue to be vigilant, that we wear a mask, we watch our hands, we watch our distance, not being in crowds with lots of people, staying home when we don't feel well. And I think it's good that I can speak to the fact that as a young person, as a teacher of high school students, of teenagers, I see that people my age, teenagers, we tend to be kind of short-sighted. We think the virus maybe won't affect us, or that we don't need to be as careful as people who we would identify as a vulnerable population, but that just is not true. One of my very good friends from college, he is my age, he's 34, he's been in the hospital for 2 weeks in southeastern Nebraska. And so it does require us to take this very seriously and to protect the people around us who are the most vulnerable. As you mentioned, I am a teacher at Gearing Public Schools, and I'm navigating, like teachers all across the state and the country, this new reality of teaching in person and teaching online. It is stressful, but while it is challenging and at times frustrating, it is necessary work. Our students deserve the best education possible, whether we are in a pandemic or not. Thankfully, I work in a district where we mandate masks. Our admin team at the district level made sure that teachers and students in Gearing are protected, and we appreciate that. I think it's incumbent upon all of us to keep working to make sure that not only, particularly in the field of education, our students continue to be able to receive the education that they need, and also to receive the social component of education, being with friends and having those relationships established with peers and with their teachers, but that we also protect their health and our own health as well. Life in 2020 is hard, but it is our shared reality. It is our shared burden. I mean, we all need to be doing our part. I understand that now, I think, more than ever. And I was always someone who is a very assiduous mask wearer. I always would wear my mask even in the stores where it wasn't mandated, and yet I still caught the virus. And so it is so important that we do what we can to protect one another. I returned yesterday from Colorado. I spent the weekend there, and as I crossed the state line back into Nebraska, I had a chance to see the state sign that greets visitors as they come into the state, and our motto, the good life. And I think that in Nebraska, we are known for the good life because we have good people who do the right thing. They look out for their neighbors. And I think even now, it's more important than ever before that we continue to do our part so that life in Nebraska can be good for everyone. So Governor Ricketts, thank you so much for this opportunity to join you and share my story, and I'll turn it back over to you.
Thank you very much, Tyler, and thank you for all the work that you and all the teachers have been doing across the state. As you mentioned, doing double duty here with doing the in-classroom teaching as well as doing the teaching remotely as well. So we really appreciate all the work that our teachers have been doing to make sure that all of our young people are continuing to advance academically, that they're getting the opportunity for all the other things school brings with regard to, socialization and mental health and physical activity and nutrition and all the things that kids get out of school. So thank you very much for being with us here today, and thank you for all that you're doing as a teacher. We appreciate it. All right, next, we're going to talk about another program that helps our young people out. And this is Jobs for America's Grads. Now, this is a program that has been around for quite a while, but we just launched it here in Nebraska in January of 2019. And that initial program that we launched in 2019 was in conjunction with Iowa. Iowa had an existing program, and so they were able to help us out to be able to get ours started here. But now we're taking the next step of becoming an official affiliate with Jobs for America's Grad, with our own affiliate status here in the state of Nebraska. That's made possible through the United Way of the Midlands, so we're really grateful that the United Way has stepped up to be able to help us do this. Now, Jobs for America's Grads really targets kids that we think may be at risk with regard to their academic progress and how they may do after they graduate from high school. So it's a program, a class that will help them. Sometimes businesses get involved to be able to help mentor them. It will do all sorts of things for these young people. It will help them learn how to write a resume, how to do a job interview, how to appropriately dress, answer the phone, shake somebody's hands. It's team-based learning. So it's project-based learning, as PBL is actually what it's called, but basically it helps them to work together in a team so they can be successful not only in school but after they graduate. Right now, it's serving about 250 students here in the state of Nebraska with follow-up services to 45 additional students. We've got them in some of our Nebraska cities like Fremont, Nebraska City, York, and so forth. It's on the Omaha Nation. And we look forward to continuing to expand that. We've had a great success rate with that so far, 98% graduation rate and 92% success rate. And that's defined by as that young person after they graduate, they either have a job part-time or full-time, or they're pursuing their education, either vocational education or some sort of post-secondary education. And we're excited that starting in 2021, we're going to be expanding to the Omaha Public Schools. We'll start off with Bryan Middle School in Monroe in the spring, and then in the fall of 2021, we'll be at Bryan High School and Benson High School. And we look to continue to be able to expand that program in Omaha and all across the state. As I said, this program would not be possible if it wasn't for the help of the United Way of the Midlands. So we have Matt Wallen, who used to be with our Children and Family Services division, is now the Senior Vice President, the Senior Vice President, I got your title here, for Community Impact and Analytics. So we appreciate, Matt, you being here to talk about United Way's role in helping us become an official affiliate. And then after that, we're going to have Ken Smith, because we saw his name up here earlier. He's the National President for Jobs for America's Grads, and Matt will introduce him. So with that, Matt, I'm going to call you up.
I'd like to say on behalf of the United Way of the Midlands, I'd like to thank you, Governor Ricketts, for your leadership and support of the Jobs for America's Graduates program in Nebraska. I'd also like to thank Commissioner John Albin and his team at the Nebraska Department of Labor for their strong partnership and guidance in successfully transitioning and implementing the JAG program here in Nebraska. I'm very pleased to have both the governor's and the commissioner's support to establish and grow Jobs for America's Graduates. As the governor mentioned, Iowa JAG operated the program for the first year, and now United Way is the affiliate member of JAG National and operating the accredited program in 8 locations. We're excited to report currently the program has about 250 students in the following schools: Columbus High School, Grand Island Senior High, Hastings High School, Nebraska City High School, Omaha Nation and Macy, York High School, and 2 locations in Fremont at the high school and the middle school. We're really grateful for the support of the superintendents, the principals, the teachers at each of these locations. We're seeing great momentum and interest. When we began, there were 3, and just this year we added 5, which brings that total to 8. Of our JAG career specialists, all have done a great job with their classes and programming in the schools through pandemic conditions. We have plans to bring up, as the governor mentions, we have plans to bring up 2 additional locations this January at Bryan and Monroe Middle Schools, and then next school year at Benson and Bryan High Schools. So why JAG? Well, this is a program that sees results. It is a program that extends help to students who experience or face significant barriers to being successful at school and may run the risk of not graduating. This program supports them through graduation and afterwards for 12 months, ensuring they have either sustainable employment and or furthering their education, which ultimately leads to a career. This is accomplished through supportive classroom setting that focuses on practical life skills and project-based learning approach, those PBLs. JAG Nebraska's 2020 senior graduation rate was 98% and will be 100% when that final student crosses the finish line this December. We also have goals around employment after graduation, full-time jobs leading to a career, full-time employment, and post-secondary education. Leading up to graduation, we have goals for the students around school attendance, being on track to graduate, reducing the number of office referrals, and improving their grade point average. The JAG program model has been successful for 40 years. It currently serves about 76,000 students each year in 39 states and consistently achieves a 95% graduation rate. We are honored that JAG Nebraska, in association with United Way of the Midlands, is an official state affiliate. Again, I'd like to thank Governor Ricketts and Commissioner Albin for their leadership and strong support of the program. And now I'll turn it over to Ken Smith, the national president, for a few remarks.
Thanks, Matt. Thanks, Governor. We've been looking for you, Governor, for a long time. We were anxious to bring JAG to Nebraska, and on behalf of our National Board of Directors, which actually includes 14 governors, the largest number to serve in any board in the country, thank you. We know from our 40 years of experience, it's always a risk to try something new. Governor, you decided to take that risk based on the results you heard about from others, I know. And I also want to thank you for being so personally involved, checking in and meeting with the students, talking to the staff, talking to the teachers, talking to employers to be sure that this was right for Nebraska. And you've just cited the answer to the question. When you get 100% graduation rates, 86% are in full-time jobs. I know you know this, but on May 31, the highest unemployment rate in the country was among 18 and 19-year-olds. It was 30%. Not if you were in JAG, it was only 11%, 3 times lower. And fully 90% at the end of May were doing something full-time, as you said. It was work, college, or the military. That's when so many young people were not able to be in school or be in jobs. So we're very excited about these results. Our very special thanks to Commissioner Albin and his team, who did some more due diligence before even talking to you about it to make sure it was right for Nebraska. And they've been so helpful with both the funding and other support. Our special thanks to Matt and his team at the United Way, Midlands, having that kind of private sector leadership to make sure the business community and the nonprofit organizations across the state are involved will be invaluable here as we expand the reach of the program. None of us knew this, of course, but our timing could not have been better because we're in the right places in Nebraska at the right time to serve the right population that too often was hit earliest and hardest by the multiple impacts of the pandemic. Matt and the team, by the way, did a great choice of bringing in Jim Lambert from his many years of experience with JAG in Iowa, and we relied on him to help us in South Dakota as well. So you've got a really experienced and seasoned leader to help make sure this goes and continues to do the job that we're doing. Finally, our appreciation to the schools, as I know you've all said. Once again, it's never easy to bring a new program into a school. You need classroom space, you need time with the students, you need scheduling, and they've all been very helpful and very responsive. And I think they're seeing the value here that extra effort has made. So just know that we're thrilled to have Nebraska as a full state affiliate. And I think Matt has got a plaque that signifies that. So we want to be sure to feature that in our upcoming publications, and we're going to be watching Nebraska. You'll be pleased to know, Governor, it's one of the highest performing state affiliates of all of our 39. So thank you all very much.
Great, thank you very much, Ken. We appreciate you joining us here this morning by Zoom, and we're excited to have the full state affiliate going on here and looking forward to continuing to expand it. So thank you very much. And our Commissioner of Labor, John Albin's in the audience, so I want to say thanks to him for his help in getting that going. Thank you very much, John. We appreciate it. All your work with you and your team to get this program going. All right. One other thing I want to hit up, or a couple other things I want to hit upon. One, I read the article in the Journal Star that talked about some physicians who were talking about beans over beef, and just wanted to comment on that there isn't a more nutritional food source than beef, more nutritionally dense. For example, you would have to eat 3 cups of quinoa or 3 cups of lentils to get the same nutritional value as you would have 3 ounces of beef. So beef is a part of an overall healthy diet, and this is really part of a national program to spread misinformation about the health benefits of beef that would ultimately undermine our largest industry here in the state of Nebraska, the beef industry, and our way of life as well. So I just want everybody to know that beef is actually a very nutritional food source for you, and I'm not going to be supporting replacing beef because it is so healthy for you. Second thing. Second thing is the upcoming schedule. So 2 p.m. today, I will have my radio call-in show on KFOR. And then also Wednesday, we'll be doing a 2 p.m. briefing right back here at the same time, same place here. And with that, we'll go into Q&A. We've got a submitted question from Emily Dwyer at WWT. Any statement or words to share about the deadly shooting at the Bellevue Sonic over the weekend? And again, just a terrible tragedy, and our hearts and our thoughts and prayers go out to the victims and their families. We're so sorry for your loss, and obviously this will be something that is investigated and justice will be pursued on that. But again, to the families, we're just so sorry about this terrible, terrible tragedy. Taylor, did you have additional questions that were submitted?
Jeff Robb asked, if the hospitalization number is at 25%, what is the process for moving to the next phase? Is it automatic, or will you announce a certain time for the phase to take effect?
So the question was from Jeff Robb at the Omaha World Herald, if we hit that 25% threshold, what will be the process? We will issue another directed health measure, and then those, when the directed health measure becomes effective, then that's when we'd be following all those rules. But we really want to set that expectation for folks that if we continue to see rising hospitalizations and we hit that threshold, it could be as early as this week, it could be before Thanksgiving, that we see that threshold go into place. So again, folks, please take all the steps to reduce the spread of the virus and pay attention as we may be hitting that red category and going into those further restrictions.
Tom Becca asks, if your goal is to minimize the spread of the virus, would it be more effective to have feature people who spend a month in the hospital or on ventilators showing how bad it can be, or overworked hospital workers instead of young healthy people, or at least show that side as well?
So Tom Becca asks, if we're trying to really help people understand how the virus can impact you, shouldn't we show people who spend a month in the hospital on a ventilator rather than young people like Tyler? And actually we have, Steve Schrader, for example, was one of our first people that we brought in to talk about just that experience. So we have been trying to get a variety of folks. Steve obviously had a very difficult fight with the coronavirus earlier this spring, and was just what Tom Becca was talking about. But we also wanted to show that young people can also be impacted and have lingering health effects from the coronavirus. And I really appreciate Tyler getting the message across here with regard to, you know, just because you're young doesn't mean that you're going to be immune from getting this virus or having severe effects.
That's all I got for now.
Okay? Here in the studio. Yes, Martha.
Governor, last week you made mention of the transition between the administrations and acknowledging that there will be a new administration. What are your thoughts about the president continuing to block efforts to provide transitional information to the president-elect?
Well, with regard to the transition, again, the president is pursuing his legal options with regard to the election, and I don't think those are all expired yet, so that we have a process here in this country to be able to go through this. We have deadlines to be able to meet, and we just got to follow the process. We will have an orderly transition of power if that's the way the legal cases run, and certainly encourage the president to help with that transition once it becomes appropriate time to do so.
When do you believe is the appropriate time to do so?
Well, again, we got a process with regard to all the legal challenges. We have to allow that process to, go through the legal courts and so forth to be able to allow the president to be able to pursue his legal actions. And again, there's times and deadlines for all that sort of thing, and we just got to let the process play out.
Governor Ricketts, you recently joined Parler, the social media app. What was the reason behind that decision? And for folks in Nebraska who may not be familiar with the platform, how would you describe it?
So Parler is another social media application, kind of like Twitter, and we've continued to reach out through social media to get to all sorts of folks along the way. And so I think we also added Snapchat on that same day. So again, it's just part of our expanding reach to get to people where they are.
And with Parler, the idea behind it is that it doesn't suppress free speech. Is that one of the reasons why you chose to join it, as maybe you've seen on Twitter's feed on notifications about, this claim may be disputed? Is that a reason that you decided to join Parler as well?
So the question was, Parler is it's kind of competitive advantages. They're not going to censor free speech. They're going to allow people to do it. I think that's a good thing to have free speech, and so we certainly think that's a good thing, good policy for Parler to have. But it's again, it's one of the social media platforms. We're trying to reach out to people, so we're trying to reach out to people where they are.
Governor, I know you've gone over this before, but I forget what the answer is. Is the 25% trigger a 2-week rolling
Yeah, so just to go back and explain, Fred's asking, how does this all work with regard to the plan we put in place? So we're looking at a number of hospitalizations due to coronavirus is divided by, the denominator there is going to be number of hospital beds. And so that, when that hits 25%, that's when it kicks in the additional restrictions. We will do that on the first day that happens. We will hit the red category. We will be in those restrictions. Now, we're calculating the number of hospital beds based on a 14-day rolling average. So we did remove the neonatal beds and so forth out of that for the last 14 days. But it's a rolling average based on staffed hospital beds. And then, of course, after we get to the red zone, to get back out of the red zone, to get back down, drop into orange, it will have to be a 7-day rolling average of being below 25% to be able to get back into the orange.
And is 1070 still the estimated number for?
So the question is, what is the number right now for us to be able to hit that? The number does move because staffed hospital beds vary. As I mentioned, we took out the NICU beds and so forth, so that number does change. It kind of floats around, and that's why we've got that chart. So first thing, if you go to our coronavirus dashboard, you'll see that chart pops up right away. That red line is where we are, given that current calculation based on hospital beds, and you'll see the bars are the number of cases. So when those cases hit that red bar, that's where we'll hit it. So 1060 is roughly where it is today, but again, that number can change.
We have a question from Julie Anderson. We've had 122 deaths over the last week related to coronavirus. That's nearly 50 more than the week before. Why not go to the red phase now?
So Julie Anderson from the Omaha World Herald says, hey, we had a number of deaths last week, which was more than the previous week. Why not go to red right now? And again, we've laid out the time frame based upon the hospitalizations from coronavirus in our hospitals. So again, as we've started from the beginning, this is all about preserving our hospital capacity. That has been what we've used as our metric. That's what we've used as our guiding, star, so to speak, with regard to how we make these determinations. And that's what our categories are based upon, is how many folks are in the hospital with coronavirus. And so that's what we'll continue to do, is really manage it based upon hospitalizations.
Becca Costello is asking about a HHS lawsuit challenging an arbitrator's decision overturning the agency's dress code. Is that the best use of time and resources during a pandemic?
So the question from Becca Costello was about an HHS lawsuit challenging an arbitrator's decision with regard to dress code in HHS. I'm not familiar with that, Becca, right offhand, so we'll have to get back to you. But she asked, is that the best use of time? There may be time constraints with regard to when we can challenge that. So again, I'm not familiar with that case, so we'll have to get back to you with more details.
Paul Hamill wants you to comment on editorials in the World Herald Journal Star over the weekend. Both papers demanded a mask mandate, and he would like a reaction to those calls.
So Paul Hamill is asking for response to the editorials with regard to calling for a mask mandate. And I'll just go back to the same thing we've been saying all along with regard to masks. Masks are an important tool to be able to help slow the spread of the virus. We've been encouraging that every day in my press briefings. We start off by asking people to wear a mask. We generally close by asking people to wear a mask when they go to the store. Again, when you can't maintain that 6 foot of distance, you really need to wear that mask. So there are appropriate ways for us to use that mask. We put those in our DHM. So for example, in our DHM right now, if you are in a business where your staff and patrons are closer than 6 feet for 15 minutes or more, you're required to have both the staff and patrons be masked. So we're using masks in a way that are appropriate, and we'll consider additional strengthenings of those DHMs down the road if we don't get a handle on slowing down the spread of the virus. But I also want to remind people that masks are just one of the tools. By themselves, they're not going to solve all of our problems, right? You need to use masks in that Swiss cheese layer that we keep talking about, that it's not one thing is going to be able to slow the spread of the virus by itself. It's a layered effect of wearing the mask when you go to the store. Make sure you wash your hands for 20 seconds often. Keep that 6 foot of distance between you and other people. Stay home when you're sick. Only go to the store once a week and only go by yourself. These are examples of that Swiss cheese layer of different steps we can take that will help us slow the spread of the virus. So, for example, Wisconsin has had a mask mandate in since August 1st. Minnesota since July 26th. they are also seeing a rise in cases. So again, one thing by itself is not going to solve the whole problem. We need all these things working together to be able to slow the spread of the virus. Yeah, Andrew. Dr. Antone, you're up.
Doctor, you know, if the public health hadn't stepped in and done the things that it's done, what would the matrix look like right now? What would our death rate be? What would our hospitalization rate be? You know, if we didn't put together the plan in which we did.
So Andrew asked, without public health setting in certain restrictions, certain metrics, certain programs in place to help spread the virus or slow the spread of the virus, what would have happened without that? I have no doubt that we would be in 10 times worse shape than what we are now, as far as having the number of positive cases, number of people in the hospital, and the number of deaths. So our policies have definitely made an effect on all three of those areas.
And how much heat have a lot of these public health officials had to endure or take for implementing some of these things?
So the question is, I didn't hear, if you correct me if I'm wrong, Andrew, is how much did the public health directors have in setting these policies?
How much heat, how much resistance did they've heard from some members of the public?
Oh, how much have the public resisted these policies? You know, we hear a sporadic, I guess you could say, challenges to some of the DHMs that have been put into place in some of the public health districts about whether they're legal or not, or whether, you know, they should follow them or not. And so there has been some resistance, but in almost all cases, we've gotten good outcomes from those cases.
And Governor, throughout all this, is there anything else you would have done differently at a different stage, you know?
Well, first of all, Andrew, before we go to that question, I want to just piggyback on what Dr. Antone was saying. Some of our local public health folks have received some very nasty phone calls and feedback from the public when they're just trying to do their job. In fact, we've even had to call the police in some cases because of terroristic threats. That's absolutely not acceptable or appropriate. Our local public health officials are trying to keep people healthy. So when they call to ask you to quarantine or isolate, please treat them with dignity and respect. That's that space for grace we were talking about before, that they are just trying to do their jobs to keep people healthy. And we got to remember, we're all Nebraskans, we're all on the same team, and so we need to treat those public health officials with respect. So, I'm sorry, so the second question was, would I have done anything differently knowing what we know today? You know, again, hindsight is always 20/20. I don't really get caught up in thinking about what would I have done differently if I had known things that I couldn't possibly know. We've made the best decisions we could with the information we had at the time, and we continue to do that, and then we move forward. So that's really the way we've approached it, is try to make the best decision we had with the information we had, and really, again, trying to slow the spread of the virus and preserve our hospital capacity while doing the best job of letting Nebraskans live as normal a life as possible.
And I guess going back again, if it takes 2 weeks to turn the ship away from the iceberg, and you kind of know where it's headed, why would you start turning the ship 2 weeks ahead of time?
So the question was, with regard to putting in DHMs, why wouldn't you start earlier on some of these things? And again, one of the things we've tried to do is, again, allow Nebraskans to live as normal life as possible, understanding there's lots of implications to the steps we take. You know, for example, we know a lot about what's happened in the intervening months, right? We know that, for example, if you look at the Kim Family Foundation data, that they did a survey of the Omaha Police Department and the Sheriff's Departments in Douglas and Sarpy County, that the number of suicides of people under 20 is double what it was last year, and those are 10 times the coronavirus deaths. Looking at our own public health data, we know that, for example, drug overdose deaths are higher than they were last year. We know that immunizations are down, that cancer screenings are down. So there are other health costs that go along with the restrictions that we put in place. And so we've got to try to strike that balance on all these things. And that's why we're trying to do that in a way that strikes that balance. We have seen, for example, if you just look at our positivity rate has slowed week over week. So we want to continue to preserve our hospital capacity while we're slowing things down here And that's what we're going to continue to do, and that's why we take the steps we do. We will take tighter restrictions if we need to do more because of the hospital capacity, and we will look at even more restrictions from what we said if that becomes necessary as well. Yeah, I'll go Martha, and then I'll go to you, Fred.
I'm interested in a little bit more information about this Jobs for America's Graduates program. What precisely are you doing with these kids? Who's doing it? How are the kids picked?
Matt, you want to come up and go into more things of the detail? Okay.
So the question was around what are we doing with these kids and who's doing it with regard to Jobs for America's Graduates, and how are the kids picked? They're picked by an advisory committee that's made up of school counselors, teachers, and other folks at the school, and they're also included in that advisory council is a career specialist, and that's what we as the program have, a career specialist that we employ who's actually in the classroom providing the instruction to the students. So the administrators and those folks at the school all pick kids that would maybe benefit from the program, that have struggled in the past in school, and would be able to use this program to help further their academic achievement, to get to graduation, to get through graduation, and then support these students after graduation. So the JAG model has a number of different approaches. It's classroom instruction, it's competency-based instruction, it's project-based learning, as we talked about, it's trauma-informed, but it really helps to teach the kids some life skills to prepare them for post-graduation, and sometimes that's additional education, and sometimes that's going right into the workforce and entering a career.
And so you folks are paying for a career specialist in each of these schools?
Yes, that's correct. It's a career specialist that's in these schools. They're credentialed by the Department of Education, and they're providing instruction in the school to the students that are in their class. The new programs have about 35 to 50 students in each of them, and then there's a classroom size limited to about 10 to 12 students.
And where does the money for that come from?
It's right now in partnership with the Department of Labor, who has a couple of different funding sources, including the Department of Health and Human Services, and then it's combined and braided with philanthropic private funds, if you will. And then the schools, after the first 2 years, also contribute to the program.
John, Alan, do you want to come up and just say a few extra words as well, just from the Department of Labor standpoint? Thank you, Matt.
Sure.
Thank you, Governor. I'd be happy to. We're just extraordinarily excited at the Department of Labor to see JAG Nebraska become its own affiliate. It's a program that I first saw several years ago at a national conference, and it was like, wow, this is really something that could help disadvantaged youth, at-risk youth. And so we made various efforts at the department over the years to get it going, halting at times until we had some conversations with the governor's office, asking us, they liked the program too, and asked what we could do. So we jumped in with some Wagner-Pizer 10% money to give it a jump start, contracted with the state of Iowa to run it. Worked very well with Department of Education, who came up with a special certification for us. And then in addition to our Wagner-Pizer funding that we've been able to put into get the program going, the Department of Health and Human Services has helped us very generously with TANF funds for at-risk youth, the free or reduced lunch youth as the TANF money is directed at. And but one of the things, we didn't want it to run as an affiliate of Iowa all along. They were a great partner, but we knew the way for the program to expand the most was to become a private entity, and so it took me about 2 years until Matt raised his hand on behalf of the United Way, and United Way then agreed to take over responsibility for the program, and now very excited that they have become an official affiliate for JAG, National JAG.
Thank you very much, John. Fred?
Governor, you said that the reason why you didn't let local public health districts institute their own mask mandates was because it's now become a statewide problem and you want a uniform statewide approach. By that logic, shouldn't you oppose or challenge the local municipalities enacting mask mandates? And have you taken any steps to ask the Attorney General if that's within your power?
So the question was, one of the reasons why we at the state are managing this is because it's a statewide pandemic. It's pretty uniform throughout the state right now. And that's why local public health departments are not going to be allowed to be able to take their own steps, because that all has to be approved by the state, with the exception of Lincoln Lancaster, for all the reasons we already kind of know with that. So Fred's question is, well, what about these municipalities then that are now taking their steps to do additional things with regard to, say, a mask mandate or something like that? And why are we not challenging that? And again, it gets back to, if the cities are acting within the law, they have the ability to do what they can within the law. So for example, with regard to Omaha, Omaha passed its own ordinance. They've got a home charter rule. They're legally able to do so. So if somebody in one of those jurisdictions doesn't like that, they've got standing to be able to challenge that. That would be their prerogative to do so. But with regard to the state itself, again, if those municipalities are acting within their legal authority, there isn't anything for us to challenge.
And are they acting within their?
Well, we encourage, every municipality is going to be different, and we've got, what, 600 municipalities across the state of Nebraska, roughly? So if you've got that many municipalities, it would be dependent on what each individually looks like. So I couldn't tell you if each of them is behaving legally, but we encourage them to consult with their legal advisors. Yeah, Andrew.
Have you talked to retailers at all about how you hope they handle Black Friday?
So the question was, have I talked to any retailers about how they hope to handle Black Friday? I have not. You know, this was something that, not recently with regard to Black Friday, this was something that we actually had discussions with retailers back in the spring with regard to taking steps to social distance people and, you know, wear masks and put up plastic barriers and sanitize and all that. And, you know, I think retailers have continued to do a very good job with regard to that. I know, for example, Nebraska Furniture Mart had made a policy that anybody who's coming into their store for Black Friday has to wear a mask. So I think retailers are taking the right steps to be able to slow the spread of the virus. It hasn't been brought to my attention that that is a need, that we need to have that conversation with retailers, because I think they've been doing a good job. Other questions?
How's it feel to be out?
It's great to be back in the office. So obviously I was quarantined for the 2-week period after I had my exposure, and great to be able to get back out and be here with the folks that are working to slow the spread of the pandemic here. All right, seeing no other questions, again, I'll just remind folks, again, holiday weekend, or holiday week coming up, right? So please, for Thanksgiving, smaller size get-togethers. Individual family groups would be best, right? Just the people in a small group are going to have less likely of spreading the virus than if you have a big group of people getting together to spread the virus. Dr. Lawler talked about on the call last week that if you've got, I can't remember exactly how many people, it was 10 people, 43% chance that one of them's got it. So again, smaller groups are going to be better. Wednesday night, please don't drink and drive. And if you're going to, the best thing to do would be stay home. But if you are going to go out, go to an open outdoor patio underneath a heater and have a beer there or whatever. But do not try to avoid those 3 C's we talk about: crowded spaces, confined places, close contact. Avoid that. That would be best. And then finally, again, please keep that 6-foot distance between you and other people when you're in public. Wear your mask when you go to the store. Wash your hands often. Stay home when you're sick. Go to the store once a week. And do it by yourself. All these things will help us slow down the spread of the virus. Thank you again. Radio call-in show at 2 o'clock this afternoon, and then 2 p.m. on Wednesday, another press briefing. We'll see you then. Thanks.